The Inland Empire is home to more than 4 million people, the 13th most populous metropolitan area in the United States, and the third largest in California. Not only is the area one of the most populous, it is also one of the fastest growing regions in the United States, increasing by almost 30% in the last decade. Like all areas of its size, the Inland Empire shares many of the usual big city issues: transportation, economic development, and education. But sadly, the Inland Empire suffers from one problem that does not affect her equally sized sisters.
We in Inland Southern California have less than half the primary care doctors we need. In some areas of the Coachella Valley, for instance, there's only one primary care doctor for 9,000 patients. Now, when you get to that degree of shortage, they are no longer doing primary care, they're just doing urgent care. And that's one of the reasons why Inland Southern California is in the bottom quartile of every measurable health outcome in the state.
How many providers do we have today?
Fred DeHaro sees the problems caused by this shortage daily at the Desert Hot Springs Community Health Center.
If you take this community of approximately 30 to 35,000 residents, you have 1.5 physicians providing services for the community. So you're looking at about 18,000 residents to each physician.
Numbers like these put tremendous pressure on clinics like this one.
Yaki.
In Coachella, Dr. Randolph Gibbs is one such provider.
We're still in need. You know, we need people to commit to come on out and get involved.
La corazón, okay. Examinación la corazón. That's good. Up, sorry. Good girl. Good girl.
At Kids Come First in Ontario, they see children who have no primary care doctor.
Good morning. How are we doing today?
Beverly Speak is the executive director of Kids Come First.
A lot of the children that come to us have come because otherwise they would have had to go to an emergency room and wait many, many hours. They don't have a primary caregiver. They don't have a family doctor. They don't have somebody that they can trust to ask questions.
It gets worse. The shortage will become even more critical as new people enter the system under the new federal health care reform law. Bradley Gilbert is the CEO of the Inland Empire Health Plan. He believes the impact of the healthcare reform law will be substantial.
It's going to have a really huge impact. You've got approximately 200,000 people that are going to get coverage through Medicaid, or Medi-Cal as it's called in California. But you've got another 300,000 who will be eligible for coverage under what's called the health exchange. So you're talking about 500,000 people who are currently not covered, have no insurance, having access to healthcare coverage and therefore access to physicians, hospitals, etc. So you look at 500,000 new people potentially suddenly having access to physicians. If you don't have enough now and you add 500,000 people, it's going to make things difficult in terms of access for appointments, doctors' ability to spend the time they need and care for the patients that they currently have.
I'm on my way to go visit a member, and according to our records, her children are due for well child visits.
Delia Orozco works with an innovative program designed to help people access health care in Victorville. She actually travels to patients' homes to help them navigate the medical system.
Hi, I'm Delia. How are you?
Innovative programs like Health Navigators can help, but there's only so much that can be done if there are just not enough doctors. According to Dr. G. Richard Olds, the answer is a new medical school at the University of California, Riverside. But not just any medical school.
Just having a medical school is not enough. We need doctors to go into the fields of medicine that we need in this area, and we need them to stay and practice in this area. So what we're doing here at UCR is actually building a pipeline that includes a medical school. We are drawing as many highly qualified students as we can from our own geographic area. And because this geographic area has the lowest college going rate, the lowest standardized test scores, etc., that's a challenge in and of itself. We're then going to recruit them into our medical school with a somewhat different orientation.
And just what is this somewhat different orientation?
We have a somewhat different approach. We're not building our own university hospital. In fact, what we're doing is we're partnering with the existing healthcare facilities, the existing doctors, the existing federally qualified healthcare centers to get them all working together to educate the next generation of physicians.
Dr. Olds believes that UCR is uniquely qualified for this mission because of what and who it is.
Of all the universities of California, for which there's 10, this is the school that has the highest number of students that are first in their families to go to college. This is the UC that has the greatest diversity of its students. It's the 6th most diverse undergraduate campus in the United States. And this is the UC that enjoys the best town-gown relationship. We are the UC for Inland Southern California, and we're strongly supported by our communities.
Dr. Olds' enthusiasm is so infectious that people from across the country have joined his staff to share his vision.
When you see traditional medicine, you don't have many opportunities to change the curricula. You don't have many opportunities to change the way medicine is delivered. With this new school and with this mission, I mean, the sky's the limit as to what you can do with the way that you train students and the way that you teach students. You can have a huge impact on the community.
As construction continues and ideas and methods solidify, economic concerns are paramount, and not just for the medical school.
So if we can even capture a fraction of the current healthcare activities that are leaving our region, we'll have a huge economic boom in this area.
Plus, research shows that business follows doctors. So for each new doctor who stays in the area, a new $1 million small business will be added to the Inland Empire. Everyone wins. If we don't act now, access to health care will get even worse for the residents of the Inland Empire. Now is the time to open this medical school.
The vast majority of the money that we are currently raising to open this med school comes from our own communities. And I think that that's a reflection of how strong our communities not only want a med school, but want this med school.